Which of the following is the most important quality in a nurse-patient relationship? Correct answer is option C, empathy. The primary goal of effective communication in nursing is. Correct answer is option C, to promote understanding and build trust. Which of the following reflects assertive communication? Correct answer is option B. I feel concerned when treatments are delayed. What is the first step in the nursing process? Correct answer is option C, assessment. A nurse is said to be professionally competent when. Correct answer is option C. She applies knowledge, skills and judgment effectively. Which one of the following is an example of non-verbal communication? Correct answer is option B, eye contact. Which quality is most essential for a nurse while handling confidential information? Correct answer is option D, integrity. What is the term for the right of a patient to make decisions about their own health care? Correct answer is option C, autonomy. A nurse educating a patient about diabetes management is an example of. Correct answer is option C, health teaching. What is the most effective way for a nurse to reduce anxiety in a newly admitted patient? Correct answer is option C, provide orientation and reassurance. Which of the following best defines nursing ethics? Correct answer is option B, the moral principles guiding nursing practice. What is the best example of therapeutic communication by a nurse? Correct answer is option B, tell me how you are feeling today. Which is the most effective method of patient teaching? Correct answer is option C, demonstration with patient participation. Which of the following should not be documented in a patient medical record? Correct answer is option B, nurse personal opinions. Which trait is most essential for a nurse to handle emergency situations? Correct answer is option C, decisiveness. The process of actively listening to a patient includes. Correct answer is option C, maintaining eye contact and nodding. In communication, feedback is important because. Correct answer is option C, in short message with understood. Which of these behaviors shows professionalism in nursing? Correct answer is option B, being punctual and responsible. The main aim of nursing education is to. Correct answer is option C, develop critical thinking and clinical skills. What is the nurse role in informed consent? Correct answer is option B, to witness the signature after explanation by doctor. What is confidentiality in nursing? Correct answer is option C, keeping patient information private. which is an example of subjective data in patient assessment. Correct answer is option C. Pain described by patient. Which principle is violated when a nurse speaks loudly about a patient condition in a public area? Correct answer is option C. Confidentiality. What does rapport mean in a nurse-patient relationship? Correct answer is option C. Mutual understanding and trust. The best way to prioritize patient care is to. Correct answer is option B. Use critical thinking and urgency. A nurse avoids making assumptions about a patient background. This reflects. Correct answer is option B. Cultural competence. What is the ideal nurse response if a patient becomes verbally aggressive? Correct answer is option B. Respond calmly and professionally. Which communication barrier is most common in elderly patients? Correct answer is option B. Hearing loss. Nursing is recognized as a profession because it is. Correct answer is option B. Requires formal education and ethical standards. Accountability in nursing means. Correct answer is option B. Taking responsibility for your actions.